everybody. Yep, I'm back. I love being here. I love communicating with all of you out there. It's just such a joyous thing. So many people have been telling me, including our guest for tonight, how nice it's been that MS Views and News has been able to cover a lot of different things and being here for the MS community during this pandemic. And, you know, even after the pandemic, we're going to be here. We're going to continue doing virtual programs, and we're going to be doing live in-person programs. So it'll be fun. It'll be interesting to get out there again. And we're going to start doing that in June, once a month or twice a month, or once a month for sure, some months twice. We are going to be in various locations around the United States doing live in-person programs again. And those in-person programs will also be virtual programs. So we'll do them as what we used to call as a live stream. All right. So everybody will still be involved with what we're out there doing. And that'll be a great thing. But, you know, I'm going to introduce this program in a minute. We're just waiting for a few more people to get online, and then we are going to get started. And unfortunately, I keep forgetting that we should be starting this at 7 o'clock and not 6:30, because all of our other programs are at 7 o'clock. And I think some people just forget that we're starting at 6:30. And so we see them chiming in at 7 o'clock, and I'm like, I have to apologize to them later on. All right. Anyway, let's get started, all right, because we have a lot to do tonight. We have a very interesting guest. Our program tonight, for you, if you can't see it or you don't want to read it, it's a Compass to Care, the Compass to MS Care, all right? And this is something that we started actually a long time ago, doing programs in rural America, and we could get back to that another time. All right. Again, for anybody online right now that does not know me, well, that's me in the picture. How about that? That's a younger me. All right, younger me with more hair, okay, and darker hair. All right, so being funny about that, my name is Stuart Schlossman, and I'm president of MS Views and News. I'm also an MS patient. That's a totally different story. If you want to know more about that, you can contact me directly. All right, our sponsors for tonight, we have Genentech, Novartis, Biogen, EMD, Serono, Sanofi, Genzyme, and MS Views and News, of course, helping to provide this. And you know, we're going to thank all of our supporters virtually. Need everybody to give them a round of applause and say, yay, yay. I'm glad that you did this for us. And we're going to get started very shortly. All right. And tonight we have Jessica Thomas. Jessica Thomas is a licensed clinical social worker. All right. She's going to be speaking about mental health and wellness, telehealth options available today, and other things. All right. You guys can read what's there. I don't want to read it all, but you can read what's there, and we're going to do this. So let's get started. Take it away, Jessica. Thank you for everything.
All right. So thank you, Stuart, and good evening, everyone. I'm so happy to be here. It is May is Mental Health Awareness Month, and so this is a really, really important topic for this month. But guess what? It's a really important topic for every single month and day going forward. So I'm going to today talk about a couple things. One is mental health matters, and so I'll start with that. And so that's why we're doing it. But you're not alone. So if you're on this call today, and I say something that resonates with you or speaks to you, I want you to know that that really now more than ever, we need to find a way to get help for any mental health symptoms that we're experiencing. But more than anything, we need to know, and I hope you know today, that you're not alone. There's information, resources that can support you, and I hope that I can empower you and share resources today that you feel like you can walk away and you know where to go if you need some help. So the biggest part of mental health support really begins when we recognize that there's a mental health need. And so today I'm going to talk a little bit about the signs and symptoms of mental health issues, what to look out for, who to talk to about it, etc. But really, we have to identify that there's something going on. And that's the first way that we can start to ask for help, is if we can identify some of the symptoms. So common symptoms or common mental health needs with MS, there are a couple. So the most common emotional changes or mental health needs with MS is one, grief. So grief and sadness, if you can think about it from this perspective, is really a natural reaction, a natural response to the changes that we experience, because there's can be actually quite a bit of losses with MS. And these feelings, grief, kind of comes and goes. I always say that we think sometimes that grief is like either a linear line, or you do this, you go through all the steps and then you can check mark, I've done that. But grief actually looks like a big mess, like a bunch of scribble scrabble, because grief comes and goes and it's very messy. And with MS, it's very common to experience grief and loss. We also can experience worry, fear, moodiness, irritability, and anxiety. And it can be a very normal reaction in the face of living with unpredictability. And it would be, fair to say that that anyone really could experience these changes, especially with the challenges that the MS, can bring upon. And then the third emotional challenge that's common with MS is depression. And this is one of the most common symptoms of MS. And it's important to note that in the face of MS, people may tend to, focus primarily on their physical health, and neglect their emotional health. And this is an essential, really essential component and part of living well with MS and treating your MS. So depression and, persistent anxiety, and sometimes extreme irritability are not natural or inevitable, even in people with MS. However, it's very common. So as you can see, what I'm saying here is that it could be common to experience these things, but they shouldn't be accepted. Like, this is just a part of my journey to feel like I have really unstable moods, or that I should feel very sad and depressed. These are things that you shouldn't accept to be a part of your journey, because this is something that can be treated. These changes, they require treatment, just like any other the physical symptoms of the disease. Mood changes can be a significant source of pain and distress in and of themselves. So it's important to note that we've got to treat the emotional aspects of MS. Now, what are the causes of increased irritability and moodiness in MS? So depression and anxiety can definitely cause this. Also, there can be changes in your brain. You can have lesions or impact an area of your brain that might change and make you a little bit more prone to depression, a little bit more prone to having some mood changes. And then also just the challenges that come from living with MS can cause this. So it's important to know that it can be a variety of different things. I know a long time ago with MS, and talking with my own neurologist, it was like, is it the chicken or the egg? What came first? And really, it's multiple reasons that can cause irritability and moodiness with MS. So we're going to now talk about how to recognize signs of mental illness. And there are a couple of hallmark things that I think are important to mention. The first one is thinking process. So to examine your thinking process. So how have you been experiencing any confusion? not cognitive decline, but just confusion. Any feelings or changes with short-term memory, long-term memory, paying attention. Also, how has your thinking and your thoughts been? Are you feeling more? Are you able to make decisions easily? Are you struggling with feeling anxious over having to make decisions? Are you is your thought process? Do you feel like it's been very negative? Is it hard to feel positive about things? Another thing to look at, a hallmark, is mood swings or major emotional shifts. And one thing I'm a counselor and I work with patients, and one of the things that I will sometimes have people do is track their moods. And this can really help me understand how they're doing and how their moods are. So I might have them use a planner, and I might have them track their sleep, their moods, and I might even have them track their MS symptoms to see if there's a connection with their mood swings, or if they're experiencing very big mood swings, or if they're noticing that on days that they have more fatigue, that they tend to feel more down. Like we want to look at trends. But also another thing when I'm working with patients that when I'm trying to assess if there's some mental health challenges, is looking at their behaviors, their eating, their sleeping patterns. Are they sleeping well? Are they sleeping more? So, are you sleeping more than you usually do, or are you sleeping a lot less? How about your appetite? Has your appetite increased? Or is it decreased? Have you had a loss of appetite? Do you find yourself coping with eating? That can be a common thing for some people, and some people lose their appetite. Also, delusions and hallucinations. This is not common in the MS arena. It's definitely common in some other neurological diseases that I work with. But are you hearing things and seeing things that are somebody else could not hear or see that was beside you? That is definitely a hallmark of a mental illness that needs to be seen, or it needs to have the attention of a doctor. And then social relations or withdrawal. How has your social interaction been? I know during COVID, it's been very complicated and hard to interact with people. So we have seen, that it's been really hard for people that stayed home and stayed safe, yet, social isolation was a little bit higher. And right now during COVID, that was kind of normal, right? But in general, I'm ask people, a pre-COVID period, I'd ask, how are you doing socially? And even during COVID, are you connecting with people via video? Or now that things are feeling a little bit safer with the vaccines and things are opening up more, are you making plans in a safe way to interact with other people? But if you notice that you don't have any desire to be around others, if you and you used to like to be around others, then that's something to think about as well as a possible sign. Also, daily activities or responsibilities. Are you able to get up, kind of follow a routine? Are you what keeps you kind of going? If I'm working with someone who is in working, I might make sure that they're still able to keep up with all the things that they are supposed to do in terms of like going to their job, maybe taking care of their kids, etc. And then also with mental illness, you'll see complaints about physical ailments. This one I kind of was a little bit torn on putting on here because I know with MS we have a lot of physical ailments, but I'll hallmark some of more of the depression ones that I see. Not neuropathic pain, the pain that you might experience with your MS, but with depression, people do feel more pain usually. Headaches, stomach aches, feeling nauseous. And then another hallmark of or sign of mental illness or a need to see a doctor or talk to someone about a mental condition is drug and alcohol use. Is that what you're engaging in to kind of escape, how you're feeling, or even sleep? Are you oversleeping to escape how you're feeling, etc.? So some of these symptoms, it's not a collective list. It's not all encompassing, but it is definitely a really good example of the signs of mental illness. And these are the things that when I'm meeting with someone that I'm kind of assessing and I want to see if they're experiencing these. So we'll move on to our next slide. And this one is one of my favorites. I have a couple of these in the next couple slides. People say depression feels like. And so the reason why I like this is often when we are experiencing anxiety or depression, we may feel alone, or if we're experiencing other mental health symptoms. But this right here is an example. It's an infographic that I used with many of my patients in a previous role that I worked in. I sought it out specifically for this presentation. So people with depression says that it feels like drowning and no one sees it, and you feel helpless against the water around you. I can tell you as a therapist, I've worked with clients and patients that said that it feels like they're kind of drowning, or that they feel heavy in the sense that you feel heavy and tired, and it's like moving through quicksand. That it's hard to be happy or to accept love. That depression can feel like you are a burden. Depression can feel like an overwhelming sense of sadness about life. So as you look at these, if you know, this is a really great slide to share with someone if you're worried or concerned that they maybe have symptoms of depression, to see if they kind of understand what some of these feel like, because I bet that it will connect with someone. When I showed this with a group I used to work with, a lot of them felt very connected and kind of seen, because it's hard sometimes to explain kind of what depression feels like, and hearing it from examples from other people, I think can be very therapeutic to see that you're not alone. But then on our next slide, we are going to talk about how having a depressive disorder, what it's not. It's not being just sad about a bad situation. Having depression is not grieving the loss of a loved one. Depression is not all in your head. It's not overreacting or being overly emotional. Depression is not something that everybody experiences. Surely everybody has experienced sadness or feeling down, but depression, clinical depression, is different. Depression is not something that a person just gets over. It's not a pity party. It's not being stuck in a rut. It's not a choice. And it's not a sign of weakness. And it's definitely not a character flaw. Depressive disorders it's a real illness. When with MS, you may have fatigue, and or you may have neuropathic pain, and so you may be open, or bladder issues, like treating those things. Depression, it really falls in the category in the same way of those things. If we need to treat symptoms of MS, the emotional symptoms need to be treated as well. And so depressive disorders are a real illness that affects and involve an extended period of feeling very low, and it really disrupts a person's ability to enjoy life. And so it might affect your body. You may experience, headaches, nausea, feeling tired. It may affect your thoughts. Some people that I work with that have experienced depression, sometimes they don't feel good enough, or they feel guilty, or they have a really hard time moving away from feeling negative. And then it can affect behaviors. It can limit you from wanting to interact with other people. You may have decreased interest in things that you normally liked. And you may have trouble starting things and finishing things. So that's a little bit about depression. And now we're going to talk about anxiety with that same infographic, or just a different variation of it. Now, I'll be honest here. Anxiety is something that I deal with. And I would say out of my MS, that this is a symptom that's been with me the longest. I have managed anxiety. I've worked really hard to manage it. But anxiety is something I can identify with. So as we look at this, these quotes, I want you to think about, if you've ever felt this way or like this before. People with anxiety feel like that it feels like constant worry and fear, or not being able to relax, needing to escape but not being able to, or feeling like your heart is beating and it's going to beat out of your chest. Or maybe some people with anxiety feel like they can't breathe. The air's all around them, but they can't get to it. And anxiety can definitely feel like you're powerless against your own mind. So now we're going to talk a little bit about what anxiety is not. Anxiety is not, or having an anxiety disorder is not just stressing out. It's not being a neat freak. It's not having feelings of anticipation before a big event, like being nervous or having a little bit of butterflies in your stomach. It's not that. It's not an excuse to get attention. It's not being nervous with good reason. Having an anxiety disorder is not fear in a dangerous situation. Because after all, you should have fear in a dangerous situation. It's not being shy. It's not a choice. It's definitely not a sign of weakness, and it's not a character flaw. Anxiety disorders are real, and they're real illnesses that are based on fear. They can affect your body. Physiologically, they can, your heart can beat faster. You can have sweating of your palms. You may feel like you could faint. For some people, they may have muscle tension. And it can be different. Anxiety, when it is in full effect, probably at the tippity topic, the panic attack symptoms can happen, but also their thoughts. So with anxiety, you can have exaggerated worry about everyday life, fear. Some people have a fear of dying. Some people have a constant replay of worries or thoughts. Some people kind of almost have like they relive events that happen, and they replay and replay and replay and kind of focus on that. Some people with anxiety, try to, numb their thoughts. And then there can be behaviors, rituals that seem impossible to control. So for somebody that, is fearful about, something happening, they may have a couple of, I'm trying to come up with an example. They may have a ritual where kind of like obsessive compulsive disorder, where they make sure they lock their door a couple times, or they make sure that they have their car keys in their hands. People that are another behavior, they could be easily startled. They also may avoid people or places because they know how anxiety feels, and it feels so uncomfortable that they don't want to engage in that feeling. So they may limit some of their behaviors and some of their interactions because of feeling anxious. And then they might be a little bit irritable as well. So Every mental illness has a list of symptoms, but these are common ones, and these are ones that I've talked about. But I want to reiterate this again, and then we're going to talk about communicating with your healthcare team. So, if you've had a loss of appetite or a change of appetite, if you've been thinking negative thoughts about yourself, if you catch yourself feeling frequently anxious or worrying a lot, or if you've noticed that you've been irritable or more moody than normal, if you've had trouble concentrating, if you're not enjoying life as much as you used to. One of the things there, I will ask people during a clinical assessment, I will ask them what their hobbies are, what their interests are. And that's really important for me to kind of find out what matters to them, what do they enjoy. And then I ask them, are they still doing it? Has that reduced? Have you been still participating in those, or have you decreased those activities? Another thing is, finding day-to-day life difficult, kind of getting out of bed, going to work. For some people, even just getting in the shower. Now, this is separate than fatigue and that it's hard to get up in the mornings. This is like a very different feeling. It's not that it's physically hard. With depression, it can feel physically hard, but it's an emotional response that is just really hard to do all the pieces throughout the day. And then trouble sleeping or sleeping too much. And then, of course, seeing or hearing things that are not there. So these are things that I challenge you. If you are experiencing these, I want you to communicate with your healthcare team. If you've noticed these things and any of these symptoms and they've lasted more than the last couple weeks to a couple months, I want you to consider making an appointment either with your MS specialist or your family doctor. A primary care doctor can definitely help treat, and they are very equipped to be able to treat anxiety and depression. I know for me, since my anxiety was so related to MS and my diagnosis of MS, my MS specialist manages my anxiety with me. He's been my primary doctor for that. But for some people, they may choose to use their primary care physician, and that is totally okay. We're going to move on to our next slide. So you might be wondering, what can my doctor do for my mental health? So your doctor actually can do a lot. And the type of counseling that I do, I work primarily with people with neurological disease, but I actually work a lot with primary care doctors as well. And the majority, if not all of my referrals, if they don't come from self-referral, they come from doctors that are sending their patients to me specifically. And so if you tell your doctor that you're having some mental health challenges, that you've had some symptoms that are bothering you, your doctor's going to ask you questions about your thoughts and your feelings, and they're going to help better understand what you're going through. So your doctor should be able to understand if there's been a lot of stressors going on or environmental reasons that are causing the trigger or onset of these symptoms, or are these just sort of out of the blue? The primary care doctors and MS specialists, I have no doubt, have seen a lot of symptoms that kind of came up after the experience of COVID these past year and a half or so. But also your doctor can give you reassurance that you're not crazy, but you do have a medical problem. Having a mental health need can be a diagnosable medical problem. And there's good news in that. It's because it's treatable. And so sometimes I have people that are just very nervous about the having a diagnosis of depression or of anxiety to follow them. And we need to stop the stigma, because we need to be able to treat these symptoms. Especially if they are bothering you and if they're to the effect where they are a medical problem for you. Now, doctors will also tell you what kind of support is available, such as counseling. So again, in my area, the doctors in our area will just refer straight to me because they'll know that they'll know the patient will be a good fit for me, and I'm their resource. But your doctor is going to know your community, and they're going to know the resources in your community, and that is pretty great. So that's why I want you to talk to your doctor if you're experiencing these symptoms, because they can help you find help. They also can offer you medicine if it's appropriate. For some people, just counseling can do. For some people, medication is necessary. And I'm a big believer that sometimes both can actually be great. Sometimes depression or anxiety can be too paralyzing, where it can be hard to work on coping mechanisms and hard to work on the things that you're going to work on in counseling without the help of the medication. But medication alone sometimes is not the only thing. Sometimes I think it's a perfect blend of both of them. But your doctor would be able to offer that to you if that is something that would be appropriate. And then your doctor is going to be able to recommend lifestyle changes, such as exercise. If you've been involved in the programs with MS Views and News, you know how important exercise is and wellness things. And those things really impact mental health. And then your doctor can refer you to a specialist if they think that would be more helpful. So there are times that I work with patients that are referred by even their MS specialist for counseling, and their MS specialist is also managing their mental health needs. And in counseling, the patient and I decide, and then I coordinate care with the MS specialist, that the patient needs to see a psychiatrist, that the mental health needs are quite expansive, and psychiatry would be very beneficial. And so sometimes psychiatry is a really helpful tool as well. And your doctor would be able to refer you to that resource if needed. And then the last thing is that your doctor is going to be able to follow up and will make follow-up appointments just to monitor how you're doing and how you're responding to your treatment. So talking about your emotions is actually a really, really relative thing to do, and really important thing to do with your doctor, either your primary care doctor or your MS specialist. So we'll move on to the next slide. For those of you, if any, if you've ever had a mental health crisis, these are some things I want you to think about. How to handle a mental health crisis. This is a good thing for you to know if you've never had a mental health crisis, and this is a good thing to just sort of have in your back pocket. So if you're having a mental health crisis, one of the things that you will be assessed is, what's the nature of your crisis? Is it something that requires treatment urgently? As a counselor, I filter mental health crises with patients. I will have patients contact me and need to be worked in quicker, and I have to assess, what is the nature of their crisis. If you ever find yourself, or you know someone that finds themselves in a place of wanting to harm themselves or harm someone else, it's immediate. It's important to immediately contact a 911 or go to the hospital, because this is an immediate mental health crisis. If you're not sure that it's urgent, I want you to ask yourself if you've thought about what method you would use. This is hard to talk about with suicide, because sometimes when we talk about self-harm, people fear that if we talk about it too much, that it will cause them to create a plan or follow through. And that's not the case, actually. It's important to know, an important conversation. Sometimes people experience passive suicidal ideation, where they maybe have thoughts of not wanting to be here, but they don't really have a plan or an intent of self-harm. They just don't know how to handle the depression that feels really bad and those thoughts. So if you have a plan or a specific thought, I want you to go to 911, call 911, go to your local emergency room or mental health hospital, etc. If you're still hesitating, talk to a family or a family member or a friend and have them stay with you while you call the National Suicide Prevention Hotline. I'm going to make sure I provide this information in the next slide, but don't move this slide quite yet. I'm not finished. And then I want you to get in touch with your mental health professionals. Tell the professionals, and if you don't have a mental health professional, tell your doctor. Reach out to others and do this to take care of yourself. Often, if someone is in a place of mental health crisis, their mental health symptoms are not managed, and so they're not able to think and think clearly and see clearly, and we need to make sure that you get the right help and assistance. So we're going to move on to the next slide. These are suicide prevention resources, and I'm going to talk about them a little bit. And it's been a while, but I actually sometimes I will call. I've done the text ones more recently, but I will text and I will do this to test it, to know that when I give you guys resources and when I give my patients resources, that I know what they're going to get. And so what I recommend is if you live with depression or anxiety, and if you've ever have experienced it, this doesn't hurt to have plugged in your phone. To take these numbers and plug them in your phone so you have them if you ever have an emergency. So here you'll see that there's suicide prevention line. There's also a national, it's called NAMI, the National Alliance on Mental Illnesses, and they have a text line that you can text. So I hope that if you can freely share these with people, if you feel like there's someone in your circle or that you care about or you're concerned about, that you can share them as resources. So we'll move on to the next slide. And then this is NAMI. And the reason why I put NAMI here is there's a lot of resources for mental health, but I am a big fan of NAMI. So NAMI will offer mental health education, support groups. There's the helpline and the text line that was on the previous slide. There are a lot of education programs, and there's a library. There's also a lot of local NAMI resources that you can access. If you love someone living with mental illness, and I have no doubt someone on that's listening or watching today or watching in the future, that we all probably have been touched by someone who does experience mental illness because it's something that is common and happens. These resources are really helpful. And so there's resources for people that love and care about someone with a mental illness as well. So I encourage you to look up NAMI. It's a great thing to learn about and to access, and you get to access it no matter where you live. So we're going to pause here. This is the famous slide 18 that Stuart was talking about, and we're going to check in. I wanted to do this because we're going to transition to talk about telehealth here and next, but that was a lot of information, and I figure that some of you might have questions.
And great, because we have questions. Isn't that nice? All right. So for anybody, though, that has questions that haven't sent them in yet, please type them, all right? Because I can't read your mind, and I don't want to be delusional about it. So I really need you to just type them in, okay? All right. So I have some questions, though, that people wrote in ahead of time. And the first one is, I can't find. I'm sorry to say, but hold on one moment. What do we do? What can we tell somebody that has a friend or a relative that is having some mental health issues and they don't know what to do about it? How can they help that person? How can they direct them to go somewhere else?
Okay, so that is a really important question, Stuart. So if you know someone, if you care about someone and you feel like they are having some mental health concerns, say you're a member of a support group and one of the support group members has been more down, or you've noticed that they haven't been feeling as well, what I would like for you to do is talk to them, ask them how they've been feeling, reach out, connect. And then I would like, if you can, encourage them to talk with their doctor or talk to their MS specialist about it, to let them know that they're not alone, to try to see if you can help bridge them to help. But the important thing is, and this is a really hard thing when we love people and we want to do things for them, is that they have to want to do it themselves. So if someone is not interested in seeking help, you can't force them, but you definitely can provide the resources to them.
Okay, thank you. All right, the next one was from a person who just simply wants to know how they can find help. I mean, what do they have to do? This person's in rural America, so that really becomes a little bit more challenging. But if you could answer that, please.
Absolutely. So I'm going to answer that and tell you something too, real quick. So I live in North Carolina. It's not super rural, but we have rural Virginia right across the way, and I work a lot with people that are needing to find counseling resources, and I actually see a lot of people in rural Virginia, and so. I know firsthand that it's really hard to find resources in rural Virginia because I have tried to do it. So what I am, and I feel like something is coming up on a rolling walker, I don't know, on our screen. And so I have no idea. I'm not doing it though. I'm not the cause of that. But so what I would recommend is one thing, is that you probably have a healthcare provider that is in your area. And while there might not be a lot of counseling options, my guess is that your healthcare provider is going to have a sense of what resources you have available. If not, we're going to talk a little bit about telehealth, and that is an option right now. But I would like for you to start with your healthcare provider. And start with maybe your primary care physician, because your mental health or your MS physician probably is far away, and I'm guessing in that case. And then there's other resources like the National MS Society in terms of finding a provider. But I would like for you to really start as local as you can.
Okay. Next one is a person is writing, okay, I'm depressed. It's a depressing condition I'm dealing with. People tell me I'm depressed only adds an additional element of frustration to it. A tip or two on dealing with that would be helpful.
Okay. A tip on dealing with depression?
A tip on feeling depressed.
Okay. So if you're feeling depressed, and I would imagine it is frustrating if other people are like, you're depressed, and that is something that I would imagine that could be frustrating to hear, and it is frustrating. That's just a part of your experience, and I'm sorry. What I would say from a tip from that is to know that you can probably make some small changes that can be very helpful. Little changes, like tending to, tending to a routine, having a little bit of structure in your day probably will help some. Also, having a little bit of interaction with others might help some. These are definitely not cures for depression. But then more importantly than that, maybe connecting and talking with someone, depending on where you live, and in our area, we have some mental health peer programs, and NAMI has those too. But maybe talking with someone else with depression, just to kind of know that you're not alone.
Correct. Thank you. Now, a person is writing, how can I know if sleeping a lot is a sign of depression? And before you answer that, just remember that some people with MS sleep a lot. So
I know.
Right.
So there's a difference. I believe. So with depression, you are, with MS, fatigue is common, and sleeping a lot is common, right? And then with depression, you can feel overall kind of tired and lack of motivation. But there's a difference there. So if the depression is the core of the sleeping a lot, you probably have some other symptoms that pair along with that. What are your interests right now? Have you had any changes with your day-to-day life doing activities and stuff? What has your mood been like? I also know that staying in bed can also lead to a lower mood because you don't feel as productive. And so we have to kind of tease out MS makes it messy, big time. We have to kind of tease out what's an MS symptom. But with depression, my feeling and my professional opinion would be is that would be some other symptoms to show that it's caused more by depression than MS, if that makes sense.
Yes. Thank you. All right. We're going to go on with, I still have more questions for you, but I want to let everybody know that after this grouping of questions, Jessica's going to switch over and start talking about other things that are on the agenda. All right. So continuing, a person is writing, hello, I live in the Mississippi Delta in a rural town. Please help me. I am the only one in my family ever diagnosed with multiple sclerosis. And this came as a shock to us all. I feel so lonely. What can you say?
Okay. I want you to try to connect with other people. Props for being on here. We've got to, get connected, feel connected. But I want you to try. You're in rural Mississippi, but I want you to see, is there any people that you can connect with, any support groups online, any, contact the National MS Society, contact some of the other MS organizations as well, and see, is there any way you can connect with other people with MS? I know that Stuart, and I don't think Mississippi is on the docket, but eventually he's doing some rural programs, and
I already got an answer for that because we already are there.
Oh, good.
Okay, so there's a hospital system in the Mississippi Delta area and all over southern Mississippi called Ochsner's, and they have an excellent MS program there. And in fact, one of the MS doctors from Ochsner's happens to be a speaker of ours down there. And so you can contact the hospital system and you can find out the support group, because I believe they also have a support group for people with MS. So that would be a place to start.
Absolutely. So yeah, that is good stuff. But I would say reach out. There's a lot of people in this world with MS, and I believe a lot of people probably in Mississippi too.
That's right. Thank you. All right. Next. Oh, by the way, everybody in Mississippi, we, MS Views and News, are doing an event in Jackson, Mississippi on July 29th. Okay? So go to our website, check it out, get registered, because we will be there live and doing it virtually. Okay? All right, great. Next one. How does one define who is more appropriate for different conversations, the PP or neurologist for people living in rural America?
Say it one more time.
How does one define who's more appropriate for different conversations relating to like depression, their PP or their neurologist?
I think, honestly, it's whoever you have the closest relationship to and who you trust. The reason I was saying primary care in rural America is because I feel like at least in most rural areas, there's not an MS specialist, but there could be your neurologist that you're working with. But I think it's whoever you can talk to, who you can trust, and who knows the resources in your community.
So that question could also probably carry over into what you'll be speaking about next on telehealth, of how they can connect. So just keep that in mind. So, because I'm going to forget, because that's me, I forget everything. All right. But maybe you can remember to follow up on this during that talk. Next question is, please address mood swings. Oh my God. God, I could do this one for you. Please address mood swings, coping with stress, and managing anxiety. I could do all three.
Okay. So addressing, mood swings, do you want, specifically, do you want tips on that or just kind of like, okay, so it's kind of open. So this is kind of weird. I opted to not give a lot of broad information about the symptoms because I knew I needed to do the telehealth stuff too. But what I can tell you is from a mood swing perspective, that it is common to feel a variety of different things and feelings and emotions, right? But if you're finding that you're having very big dips or big changes in emotion. So, say one day that you feel like, and I'm not talking necessarily about bipolar, but it's going to sound like bipolar, that one day that you're feeling very like elevated and you're in a great mood and you're staying up late and then the next day or 2 days later, you've crashed and you're feeling really sad and you're staying in bed and you can't get out of bed, or mood swings like you're quick to anger, that you're kind of like okay at 1 minute and then you're quick to snap. So that would be kind of a sense of the mood swings that I'm mentioning. Do you feel like your mood is relatively kind of stable and predictable, or would the people around you say that your mood kind of changes a lot? I know for me, and I'm just going to normalize this, if I don't get enough sleep, I am moody. And that doesn't mean I have big mood swings. It just means that I'm kind of moody. I'm not my normal kind of like even kill self, if that makes sense. And these symptoms, if you're experiencing any of the symptoms of anxiety or depression or mood swings, how is it impacting your quality of life? I know for me, when my anxiety was at its worst, guess what? I didn't drive on the highway for 2 years. That's really unmanaged anxiety. That impacted my quality of life at a great level. Patients that I work with, their anxiety, if it's unmanaged, they, may be having almost what feels like panic attacks to them, or they may feel like they can't go anywhere, or someone with depression may not be getting up out of bed in the mornings, and they may be, barely doing what they need to do to take care of their own hygiene needs, or they may not be interacting with other people. So it's kind of, is your quality of life impacted from those symptoms?
Okay. And now I'm going to add in a little something comedic about this. They have axe throwing in a lot of different locations now.
I know.
Yeah, that's right. You can take off a lot of anxiety with that. You really can do a good job. Okay. All right. Next question. Just two more, and then we'll get into your next set of topics. Are there any specific types of therapy that you can recommend for those generally she realizes or he realizes who are dealing with the impact of the degenerative and chronic qualities of the disease?
Okay. So, so with MS, therapies that I specifically recommend, for counseling, would be a couple of things. One is I do recommend cognitive behavioral therapy. And that is a great tool. It's definitely one of my favorites in terms of helping people to change, our thought patterns, because sometimes we hold on to a thought and we need to reconstruct it to a more reality-based thought, and that will change your behaviors. That's why I can drive all on the highways now. I did lots of cognitive behavioral therapy back then, but then there's also a therapy that I really like, which is acceptance and commitment therapy. And that therapy tool, I think, is very helpful. And I use it a lot with chronic disease because we have to allow space. The reality is, that I have a disease, and if you're on this call, you either love someone or probably have MS yourself, that you have a disease that causes symptoms that cause problems and distress. And so how can you deal with the changes of the disease and still and allow them to kind of be a part of the process of your life, but still have them where they don't impact your behaviors, where you so for example, if I have a day of a lot of fatigue. Fatigue, I tend to feel kind of, sometimes I can feel guilty, but if from the acceptance commitment therapy approach, I allow myself to feel, that I don't enjoy that I have fatigue, but it's kind of a part of my day. And then I help myself move from it, if that makes sense. I still am fatigued, but at least I'm not having the emotion that attaches with it, and I'm not staying in a negative space with it.
Okay, thank you for that. All right, the last of this group of questions is how common is TMS treatment for depression with MS?
That is something I actually don't, I feel like it's probably been talked about. I know I used to work in intensive outpatient therapy program, and TMS was just sort of coming back. And I do know that it is used with depression, and I do know that it's, I've seen a little bit about it for MS, but ironically, now that I've been in the counseling field for quite a while, I haven't had any patients that have used TMS.
Can you explain to everybody what TMS is that may not know?
Transcranial magnetic, what's the S? I'm sorry. It is a procedure. It's not shock therapy, but it is a procedure, an outpatient procedure. It's not anything with needles or anything like that. I'm making it sound that way. That can be done, and it is supposed to be beneficial for depression. I know it's an outpatient thing that you go and you get a couple series of treatments done, and clearly it's not that big in my area, because I feel like I could talk about it better if it was, or if I've had patients that used it. But I do know that it seems like it has been helpful. I have heard that places.
There's a center for it in Atlanta, Georgia. I don't remember for sure, but if anybody wants to know, I can get them that information. All right. Before Jessica goes into the next group of things, I just want to let everybody know that on June 9th, we have a special program that's never been done before by us, and that is with Dr. Aaron Boster speaking about men's sexual health issues with multiple sclerosis. So if anybody on here right now that are men with MS, this is a topic for us, okay? And for all the women out there, we can't say no, you can't be on this program, but please let any men that you know with MS know about this program. Go to the MS Views and News website and get registered for this event, okay? And then on June 12th, again, Dr. Aaron Boster will be speaking, because we will be live in Columbus, Ohio. All right. And we are going to do that live as well as virtual. Okay. And the topics for that are the invisible symptoms of MS, what you could do about them, what they are, how to understand them better, as well as we're going to talk about disease progression and what's available for you right now. There are no pharmaceutical companies out there doing live events right now. There are no other MS organizations doing live events right now. Live, I mean in person. So this is a program that you probably want to get yourselves up to date with. And again, visit the MS Views and News website to check this out. Other than that, we have a whole list of things that are happening in June. Okay. And you can see that in the center of our website. And Jessica's back also, I think, in June, doing a program at the end of the month, similar to tonight, but more in depth with mental health issues. Okay. All right. So now let's let Jessica take it away and talk about what's next.
All right. So I'm going to talk a little bit about telehealth. I'm going to focus primarily on mental health telehealth. And I have a hunch that probably some people on today's program, some people that will be listening and watching this probably have experienced a telehealth session at this point. Really, overview of telehealth is, telehealth can be used to, treat a chronic condition. And telehealth is essentially, I probably should back up for a second. Telehealth is essentially, it is when you're meeting with your physician, either by telephone or by computer or webcam, et cetera. And so there is also telehealth and telemedicine. I'm not going to go too much into the details. I'm just going to call it telehealth today. But also telehealth can be done, can be used to provide mental health services. So I've spent well over a year now providing counseling sessions and meeting with people only on the computer. I've met with one patient in person since COVID, and soon that will change some. But it's been a great tool for mental health. But then also telehealth is an opportunity where you can see a doctor for basic and minor things that happen. And in our healthcare system, we have a system where we, for telehealth, that we actually don't talk to the physician or we don't see them, but we could email them. So there was an option that one time I had I believe I had a sinus infection, and I signed up for an e-visit, and I emailed all the information, and then my doctor emailed all the information back, and I had a prescription, and that was my first experience at really truly at telehealth. But it can be used to diagnose, some basic things. Most doctors hopefully will want to see you or talk to you, but that was a very unique situation, but it qualified for telehealth. And then telepharmacy. One trend that I am noticing, and I think this is really important, is that we're starting to see pharmacists that are included in primary care teams and also in MS centers. And so being able to talk with your pharmacist is really important. And so pharmacists are a part of your healthcare team, and you can access some, especially if they're already integrated in your community, in your healthcare system, for telehealth. And then also telehealth offers a really convenient method for your doctor to check in with you and see how you're doing. So it can be a very easy way to get healthcare. Is it a perfect way? No, and we'll talk about some of the glitches, but it also can be a very effective and efficient way too. So we're going to move on to the next slide. So mental telehealth. There's three things I'm going to talk about here. What is a mental telehealth visit like? So for me and my patients, a visit pretty much is like this. What you're seeing is kind of what my patients see, that it's very similar to an in-person counseling session, very much so. And so in the ways that it's like the same is that I start off the session and I ask them how they're doing. I ask how their moods have been, how have they had any changes in medication? Are they taking all their medications as prescribed? I will see what events have been going on in their lives. Do they have any updates? We'll follow up from homework from our previous session. So in that way, it's very similar to a regular in-person counseling session. How it's different is that it's done through technology. And so with technology, we enter the area of things not being perfect. And so from that component, sometimes, when you're meeting face to face, there's not really anything that interferes. But sometimes when you have technology involved, you can get a bad signal or have bad Wi-Fi reception, or you can have a couple more interruptions. So I try to minimize that, but that's one thing that's a little bit different about in-person versus telehealth. And then how effective is mental telehealth? Well, I can tell you with working with patients in person and having that experience, and then working in virtually, that mental telehealth has been very effective. Is it for everybody? Probably not, but actually it's been for a lot more people. It's been effective for a lot more people than I think that they would have ever considered that it would be. I work with a lot of older populations, and they have, while we got over the technology hump of how difficult it was for them to get signed up, actually once we started doing sessions, they're professionals at it. So what happens before and during a mental and telehealth visit? So in if you were to see a therapist, and I would think that this is pretty standard, but I'll just talk from my office perspective, is that one of the first things that that needs to be done when people make an appointment at our office is the paperwork. There are consents to be signed, HIPAA forms, signs that you forms that you probably fill out at your doctor's office, but there's some that are specific to mental health. And so that needs to be completed. But you're not coming to the office, so how can it be completed? Well, what our office does, and I'm sure that other offices do as well, is that they might send the link to you. Either we mail the paperwork hard copy for people that are uncomfortable with doing it via email, or we email the paperwork to people that are comfortable, and they complete all their paperwork. And so once that paperwork is completed, we have our first clinical assessment. And in that assessment, the counselor is going to be talking with you about your experiences, what's going on, and why you're seeking counseling. The clinical assessment also is where the counselor is going to be asking all of those things that I was asking about in terms of like appetite and how has your mood been? Are you interacting with others? Are you enjoying things? Like some of those mental health signs. That's what I'm assessing in the clinical assessment. And then I'm also assessing your needs and your strengths. And usually in that first assessment, that very first session with me, I also will start your treatment plan. And your treatment plan, from my perspective, and I'm sure from other counselors, it's really based on what you need. And I really do it from what you need from your perspective. And I may add a couple things in there. So if you have MS but you've also have been experiencing clinical depression, and you tell me that you would like to find a way to feel better, then we're going to work your treatment plan around coping mechanisms for depression. And then I'm going to probably put a thing or two about MS and depression in your treatment plan too. Maybe healthy habits that will help benefit your MS and then also your mental or depression as well. And then from there, after the very first clinical assessment, then we start therapy sessions. So I'll get you on my calendar, and then we start therapy. So regular therapy sessions usually last 45 minutes to an hour. And my clients, and I know I'm not trying to recruit clients here, but I'm just kind of telling you our perspective, is that we have a platform that we use, and my patients all will have their information on how to sign up and everything way ahead of time, so to reduce any anxiety about the technology piece. But really, there's not much difference in terms of in-person and virtual. So physical health telehealth. So this is when you go to your doctor, and you or seeing your doctor through the computer or through telephone. So this is again a great way to monitor symptoms. I know during COVID, I saw my own neurologist once in person and then once on the computer, and both of them were very effective visits. And so what we're finding and hearing is, with telehealth, is that it can be very cost savings. And it is true. And it can be a little bit easier for people with accessibility issues. Virtual doctor visits for MS can make a huge difference, both in your quality of life and in the treatment that you receive. So I hope that during this period of time, you've stayed connected to your specialist. And if you weren't able to see them in person, that you were able to see them remotely. But if you're interested in using telehealth and you've never used this before, ask your doctor about it. You can ask your primary care doctor or anybody on your healthcare team if they offer it. And that's really the first step to see if it's available. I think we're going to find that some of telehealth is going to stay. I can't predict all of it, and I'm sure there's a lot of advocacy. I actually know there's some advocacy about it being able to stay as an option. But definitely, I think is going to be more opportunities for telehealth in the future, even after things kind of open up more after COVID. So we'll move on to our next slide. So telemedicine, telehealth can be used to talk with your doctor, to get education about your condition, to manage your medications, to review results of blood work or any diagnostic tests, to screen for complications of MS. I know that with MS that there are the neurological exam that they do, they can do some assessments of walking, and I'm sure that that there's more information on this in some of the other the programs that Stuart has offered, or MSB's News has offered. But telemedicine can really be it can be used to help you develop rehab exercises at home, or to build a exercise program if you're working with a physical therapist. There's a lot of different uses for it. I think the most important thing to know is that it might be an option for you. And if you haven't utilized it, find out if it's an option for you. We'll move on to our next slide. So how to make the most of your visit. Here's some tips. Having your medications with you, just like you would if you went to your doctor's office. So that way, if your doctor wants to verify the medications, that you have them there. Having your pharmacy information on hand, so that way if your doctor needs to call in a prescription, you know exactly what pharmacy. He or she may be able to look it up on the computer, but it's good for you to have exactly to avoid any miscommunications. Prepare a list of any of the doctors you've seen, any specialists you've seen if you've been to the hospital, kind of like what you would do in terms of preparing for a normal in-person visit. Check into your visit at least 10 minutes before your appointment time. I know that sounds crazy, but some of the telehealth platforms will tell your provider that you're in the waiting room, which is a great service. But either way, you want to be there, and so when your doctor's ready, that you're ready. And then have a pen and paper. Write down any questions or concerns that you have, as well as other topics you would like to discuss. So continued, other things, if you don't feel comfortable feeling like you can remember things, or if it just feels comfortable or would feel more comfortable to have somebody with you, then have a family member, friend to attend with you. And they, I'm sure would be more than happy to take notes if needed. Also, this is a really important thing. When you go to your doctor's appointment, you're in a private room, you're in a safe space to talk with them. And it's really to ensure your privacy. Well, when you're at home, your doctor can protect your space on their end. And I say this to all my patients. I can definitely make sure your confidentiality is secured on my end, but I can't on their end. So for you to make sure that you're in a private spot that is feels comfortable and safe for you to interact with your provider, and then you prepare just like normal. And this is it's a different way of interacting with your doctor, but it's the same purpose. It's to connect about your health. And then if you get off of the call and you felt confused or felt like you misunderstood something, feel more than comfortable. I know your doctor's going to be busy, but contact their office if you have questions or follow-up questions, or if there's a discharge summary in your electronic medical record, if you have access to one of those, then look there. But please don't walk away feeling confused on something that's important. If you need reassurance or you need to call your doctor's office for clarification, please do so. So there's telehealth options and opportunities for wellness. And we've seen during COVID, this has been one of the silver linings of one of the only slivers of silver linings with COVID is that we've seen a lot of access to things. And this has been really helpful for people that, and I hope they continue going forward, but helpful for people to stay engaged and still be connected with others, and then also engaged with their health. So physical therapy has been able to be done via telehealth. There's some special not every physical therapy organization is offering this, but there are some special ways that physical therapy can be done remotely. Also, exercise classes. I have loved seeing all the access to free exercise classes during this period of time, and that's a great way. And I kind of consider it telehealth because it's helping you with your wellness. Nutrition classes or seeing a nutritionist. I've referred a couple patients during COVID to a nutritionist that they could see via telehealth. It's when we need to work on connecting with a nutritionist, that's a great way to do it. Mental health groups. There are community mental health groups. There are other professional mental health groups, but these all have started to be available as well during COVID. For some mental health groups, some of them are open and some of them are closed. And open would be ones that you could sign up and that you could participate in on your own. Closed groups would be ones that you would have to sign up ahead of time, or your doctor would have to invite you to attend that group. And then support groups. I hope that if you attend a support group, that during COVID, they've offered a virtual opportunity. And if not, I hope that you've been able to find a virtual group during this time. A lot of groups that were meeting in person started meeting virtually. And I'm sure some will resume back in person, and hopefully some of them will keep a virtual option as well. And then educational programs. What a great opportunity, like today's program, to be on. What an opportunity to take advantage of wellness by attending an educational program. And then there are community recreation programs. And so we've seen those during COVID as well, and I hope that they continue. But those are like crafting classes, or there is even a virtual game night at one of our community recreation centers. So there's a lot of opportunities for wellness, but you've got to find what's in your community. And I wish if I lived in your area, or if you lived close to here, I would try to help you look up what's in your community. But with some searching and with some asking and digging, you might be able to find something. So please remember, what's available to you is not really just limited to the area you live in. So to find some resources, I want you to look where you live. But also with telehealth, this actually opens a world of opportunities. Now, I'm going to say this with a little bit of a pretense. So with counseling, right now, so I am licensed in North Carolina, and so I see patients in North Carolina, and then I got a temporary license to see some Virginia patients. So sometimes some doctors and some professions can cross state lines. And for example, the nutritionist I refer people to, she can see people in other states. But my licensure doesn't allow me to see people in other states unless I'm licensed in another state. And that might change in the future. Who knows with telehealth? Things are really moving and changing. But with telehealth, so for this example, I could have someone that lived on the coast of North Carolina, or someone that lived in the mountains of North Carolina that could see me virtually, and that have seen me virtually, where they normally wouldn't have been able to. So you might not be able to see a provider that lives out of state, depending on what discipline you're looking at. But definitely, if you live in a rural area and the resources are small, you might be able to expand out with telehealth and see a different provider that lives in a bigger area. So your network has grown a little bit with telehealth. We'll move on to the next slide, and I'm going to give you some technology telehealth tips. The first one is to relax. There's usually a plan B. I can't tell you. I have done hundreds and hundreds of sessions, I think at this point, virtually. And there is always a plan B, and I'm always thinking of it. And so if for some reason the platform doesn't work, I might transition somebody from video to telephone if we can't get it to work. If we can't get the audio to work, but the screen is working, what I'll do is I'll call them if they're not using their cell phone, and I'll talk to them on through the cell phone, and we'll see each other through video. There's usually a plan B, so just to relax as much as you can. Also, once you get the hang of it, it gets a lot easier. Charge and plug in your device, your phone, your tablet, your laptop, whatever you're using. Please make sure it's fully charged, or you have it plugged in, because that's the worst thing when you're in the middle of a session. It's really important. You're sharing information, and then all of a sudden your battery dies. It's no fun. Download any of the apps or create any accounts, for the telemedicine website that your provider uses. So this is something that you would know about ahead of time for your appointment. And it should be relatively easy to do, but sometimes it's a step we don't think about. But if you can go ahead and download an app or get prepared, that way you're not as concerned about, using it the day of, or you're not surprised about having to do it. Can you hear them, and can they hear you? That's so important. So just making sure that when you get on, that your audio is working. You'll know pretty quickly if the person can fix it on their end, they will. If you can on your end, you will. If not, just relax. There are strategies and plan Bs out there with technology. And then ensuring that you have the right technology. And so I've had a couple people that wanted to do video sessions and didn't have video access. So we moved to telephones. We moved to Plan B, which is something that I think is important. But just making sure that you have the right technology. And then besides that, call your provider or their office with any questions, because guess what? Most providers have been doing this for a while now, and they are very, very well prepared on how to educate other people to sign into the telehealth platform. So we're going to move forward, and so I have just these two slides, and then we'll go to questions. This first one is just to wrap up again. I started out with mental health matters, and because mental health does matter. And this is important, and it's an important topic. I'm so thankful. Stuart is right. In June, I'll be coming back. We're going to really talk about more specifics about mental health. This has been like an overview of a lot of things, but we're going to hone in on certain things next time I see you again. But mental health matters, and I hope if you take away anything from today, that you take away that if you have or are experiencing symptoms of depression, of anxiety, or other mood changes, that you talk to your doctor about it, that you get some help. It's one thing that can be treatable, and that you could possibly feel better than you do now if you're experiencing that. So mental health matters. And then beyond that, you matter. That's the other important takeaway of this is that you do matter, and I hope that you take care of yourself, and that you reach out to your healthcare providers and you have conversations about mental health. While I say that I've had anxiety, and that's a part of my journey, and it's managed now, I still talk with my MS specialist about it, because mental health matters, and we need to make sure we're connecting with our providers, and that they know how we're doing. So I'm going to turn this back over to Stuart for questions, and I look forward to hearing them.
Great. Thank you very, very much for being here. And I thought it was an excellent program. I hope everybody on here did as well. We do have questions that were sent to us beforehand. We do have a person that wrote in a comment. And if anybody else has questions, I have a few of them to go through. All right. Let's go with the one that gave us a comment first. And that is Cindy. Cindy wrote, for what it's worth, I really love telehealth options. Also, every single bit of information you have given us is completely fabulous. You have done such a great job covering every single aspect regarding mental health and something else, but I can't read it. So anyway, that's what she wrote. Cindy wrote that to you.
Thank you, Cindy, and thank you so much. I hope everybody feels encouraged of using telehealth, and I greatly appreciate the feedback. Thank you.
Okay. Next person would like to know if using telehealth can help build a nice rapport between the doctor and the patient, or the clinician and the patient.
I think so. I think it's. It's a tool that is just as beneficial as face to face. And so I find it as very helpful. I think that it's been easy to build rapport from a mental health perspective, as well as, as an in-person visit would do. I think once we get over the initial that we're both on the computer screen, all of a sudden you just see the person. It's very weird how it happens, but I promise that it does happen that way. But it does help with rapport, and probably utilizing some of the technologies, such as like the electronic medical record and such, can continue to help. But no matter what, your doctor should be someone that you trust, and hopefully that you have a good rapport with, no matter what. It's a good way to maintain a rapport.
Great, thank you for that. All right, I got some detailed questions, but let's go to something really simple. So a person is writing about telehealth. Is this a computer, or is this using a computer or using a telephone?
So it can be both, which is interesting. And some of it depends on insurance and what insurance covers. But I do have a couple of patients that telehealth for us during COVID has been telephone only. And it's been very nice. They prefer to not have the video, and we have really, really nice conversations, just as effective as the as video. But it can be telephone or video.
Great, thank you. All right, next one is, would you make an initial mental health diagnosis via telehealth?
Mm-hmm. Absolutely. Not without doing a full clinical assessment, the same clinical assessment that I would do in person. But I do a lot of diagnosing. I tend to not want to diagnose after a first visit, but the truth is that insurance companies really want you to usually have a diagnosis at that point. So I try my best to do a very thorough clinical assessment to understand, but diagnoses are something that can change. You may find that someone has, this has happened before, where I thought someone just had anxiety due to a medical condition and due to MS, and it turned out that they really had more of a generalized anxiety disorder. And so it can change.
All right. You're telling us about telehealth with how it regards to something that you're doing. What can you tell us about telehealth for a person that needs to see a doctor for the first time?
Okay. So if you need to see a doctor for the first time via telehealth, a lot of the information that I'm sharing is sort of the same. The preparation is going to be the same as seeing a doctor for the very first time that you haven't met before. There can be, naturally some nerves if you have not used the platform, or if you don't know what the provider's using, or if you haven't even met the doctor before. But I encourage you to be open to the process. The doctor that is behind the computer is the same doctor that would be in front of you in person if you could meet them in person, and to be open to the process. Trying to think if there's anything else that would be helpful from a tip perspective. I would say, go on.
Sorry, many people feel that a doctor can't see my physical ailments. So what can you say about that?
That's true, right? Like, so they can't see some of them, right? So in some cases, telehealth is not the best, but maybe it's a good or an okay in between. So maybe you might do a triage session with your doctor, and then they say, you know what, I really need to see you in person. You need to come in. Or they might say, based on those symptoms, you really need to come in. And so being open to flexibility, that if you're dealing with something that can't be addressed via telehealth, then an in-person visit is going to be more appropriate.
Okay, thank you for that. All right, next, we have one more question on telehealth, and then we have, actually, I might have another one because somebody just wrote in, but we also have another question to go back on concerning the mental health, and I'll get back to that last. All right, so right now, can you tell us how insurance is being handled for those that are in different states from where a doctor or a clinician or a licensed clinical social worker might be located, and how they can get that insured?
Okay. So for it really it's very different from place to place, or not place to place, but like profession to profession. So with like a clinical social worker, my licensure won't allow me to see people outside of the state, and so they're so I will not. So I can't work with anyone outside of the state right now. I think eventually we could see things changing with that. But and I know you're not asking about me specifically, but I'm just saying we may see telehealth rules change a little bit in terms of jurisdiction. But with healthcare providers, I believe with doctors, there were a lot of waivers, and this did happen in counseling some, but not as much. There were some what we saw across the border waivers that were sort of done where doctors could practice outside of their normal jurisdiction, which would be their state of practice. And so insurance was covering it the same, as my understanding. One thing we saw during COVID, and this will not stay, is that we did see with mental health that often some insurance companies were making it where the patient did not have to pay the copay, and that made things really helpful for people, especially at a time where things financially seemed kind of scary. And we will see the copays probably come back, but we have seen that insurance companies were very gracious. We're also seeing that some insurance companies, they're going to probably change, hopefully some of their rules in regards to telehealth, because telehealth wasn't really used before this. So I'm excited to see this, be more present and permanent in counseling, I hope. But I would say that insurance, it's different rules for different providers and professions.
Great. Thank you for that answer. Before I ask the next question, and it's a really good question on mental health, but before I get to that, TMS, transcranial magnetic stimulation.
Thank you. Thank you.
All right. And by the way, if whoever wants to know about that, I just Googled it. All right. Just type in TMS therapy, and you'll get all your answers right there off the Dr. Google. Okay. All right. Next, I want to let everybody know that MS Views the News is starting something new. We're doing classes on Pilates and yoga beginning in the middle of June. All right. And again, you'll have to visit our website, www.msvn, S as in Sam, okay, or sclerosis, M, multiple sclerosis, VN, Views and News, okay, and .org. And you could see all of our programs there. But yes, we have a once a month Pilates class and a once a month yoga class being taught by professionals of each, okay, and it'll be easy for you to be online, no cost to you at all right? So just come on in, join. It's for beginners, it's for people that are seasoned, it's chair Pilates and chair yoga, okay? All right, now let's get to the last question. All right, person wants to know, how do I handle not being overly anxious or stressed, getting back into the reality of the real world outside of my home without the fear of catching COVID or just getting out there and being with people again? How do I reacclimate?
My goodness, this is a thing that I'm seeing quite a bit. We're kind of calling it re-entry anxiety, and it's idea that we've been, kind of staying at home, staying in place, staying safe, and very cautious about like our social interactions, who we're interacting with, keeping our circles small. And now all of a sudden, things are changing, and they're changing fast. And so what are some tips? One, I want to normalize this. If you are experiencing any sense of discomfort, I want to normalize this, that this is something that many people are experiencing. But I also want you to know that you can go at your pace. If you're in a state or in a place that they are not wearing masks, or saying that you don't have to wear masks, guess what? You can wear your mask if that helps you feel safe. You can take care of yourself and do what you need to do for you. If going out to a crowded event is too much, don't do it. Do some smaller events to kind of reacclimate yourself back into the community. What I think is the most important thing, though, is that we do enter this reentry with some intention, that we take care of ourselves, that we can acknowledge that for some of us it's going to make us uncomfortable. It's made me. I had a meeting I went to, and I sat at a table with 12 people, and I thought, good gosh, like I felt really anxious. I didn't expect all those people to be there, and so I realized myself, like, gosh, it's going to sneak up on us, and so allow yourself to do things that help you to feel comfortable, but re-entering with intention, because we want to go back and get back to doing things that's healthy, that's what we need. This has been a really hard year and a half, and the transition back, it might be a little bit hard too.
Yeah, it'll be. But for those of us, even myself, I mean, I'm pretty open. I mean, I do wear a mask whenever I'm out in public. I will probably continue wearing it when I'm in stores or around large crowds. I just feel more comfortable with it being on than not being on. And I do know also that, and I told somebody this the other day, when flu season starts again, I will be wearing a mask because I know it works. Okay. And we might be setting the trend that it does happen in Asia, where people wear masks during certain times of year, regardless of what country that they're in. We've seen them many times on airplanes. And when I say them, it's nothing bad. All right. It's what certain people from certain countries are always wearing masks when they're in very public environments, like being on an airplane. All right. So that is probably a fad for the future, and I'm going to continue with it. Mm-hmm. Follow me.
Absolutely. And I think that, and for me and my family, I think that's a way that we're going to navigate feeling kind of safe being out. But I wish everybody, some ability to embrace as things, open up, to do things as they feel safe.
Right. Great. All right. Thank you very much for that. We had a great night here tonight. I can't wait to get this published and edit it out and get it onto our YouTube channel. And for everybody online, if you haven't seen our YouTube channel, you really need to go there. There's so much stuff there, especially since pandemic began. We're talking about, we're doing 6 to 10 programs a month, depending on the month. And I'm sure you've missed something. So visit our website, click on the YouTube banner that's on the website, visit our channel, get there, get acclimated, see the different titles that are set up for the different programs that we've been doing, of the different series. It's easy to use. And the best part is, if you get tired or you need a bathroom or you need something to eat, just pause it, okay? Or wait until the next day and you can come back to it. But Jessica, thank you, as always, for being here online with us. I love listening to you. I hope the people that have been online have gotten a great amount of information from you, and we look forward to seeing you again. And thank you, everybody, for being online. And, of course, we want to thank our sponsors again. As you can see, they've been on the screen behind me both ways, all right? And the MS News and News logo is right there. Okay, so enjoy it. And, everybody, I hope to see you again at our future programs. And, Jessica, thank you. We'll speak soon.
Thank you. Be well, everyone.
All right. Bye-bye.